Hello friends, this is Amitava Majumdar, member of Royal Institute of Chemistry, London. This video especially for the case which is basically due to the Nipah virus which has come out in West Bengal. Nipah virus have been found in many places in Southeastern countries, Asian countries before. But this time in Bengal we have found 2 cases, but nothing to worry about that. But thing is that yes, we have to worry also. We cannot say that it is gone or it is gone, because any virus, the contraction and all is because basically the 2 things. One is that if it is airborne or it is non-airborne. In fact, the particular virus, Nipah virus, is due to the bat eaten fruits, because it is zoonotic virus. So these bat eaten fruits may be causing the Nipah virus syndromes, and it is just only cleaning and washing the fruits, and after that you take, it doesn't mean that you are free of the Nipah virus, because if bat bites, the automatically virus goes in, and then it's enveloped virus. It is negative strand RNA virus actually, and it has got 18 kilobases. So this virus size is this RNA size is not small, it is big, very big, and it is found in different shapes also. Now this Nipah virus, the point is that the Nipah virus, is it the is it the cause of concern? Yes, it is variant of concern. Of course, it is a variant of concern. And usage of the same, the toilets and the beds and the shots, the patients' dresses and all can cause this. Can contract other person this virus. Basically, it is not only the taking the food which has been bite by the bats and all. Now point is that if it is that, automatically governments come into the action, and of course I welcome that tracing and the sampling and tracing, etc. are very important right now, because the contacts are very important. And 2 cases what we found in West Bengal is basically they are all going for contact tracing and all. But many times we find that and we see that the normal advice is that clean hands and clean fruits and clean dishes, etc. Soaps, detergents, etc., hand wash, etc. These are the only not the parameters. I mean to say that if the virus basically are there inside a body of human, and so it will definitely it will come out as the come out of the patient too also, and it will try to find out the other host cells. Now, if you see that the virology, because basically N-terminal is having there are a lot of proteins, like 6 proteins that they can find, and out of that the G protein, basically glycoprotein, basically, which is basically having the N-terminal and C-terminal. C-terminal part is basically having the host cell evasive tendency. So this host cell evasion can happen, and once it comes in the host cell, automatically the patient gets the feeling of nausea, then the headache, then the fever, then cough and cold, and then many symptoms we can find, especially fever and headache are very important parameters. So now point is that how we can have only tracing and then the finding out the people who are contracted, that is fine. That is to have the history of the patient, and the contact tracing is very important. But thing is that sometimes we should know that are there any medicines for this Nipah virus? Are there any vaccines available in the world? No. There is no antiviral medicine, or there is no vaccine against the Nipah virus the syndrome. So now point is that what doctors then do? They basically addresses few things, like suppose for example fever. Then in the case of fever, they go for ibuprofen and few other similar kind of medicines. If it is vomiting, let's say, then it will be ondansetron, it can be. If it is your respiratory, then automatically it will be salbutamol or any other inhalation medicines like that. And if it is neurological, then Finton and other medicines are there. So those medicines basically they the doctors use for case to case, like for vomiting, for fever, for neurological like neurological disorders, like if it comes around, so automatically they use that. But point is that are there really that any other products we have in India? I say that yes, we have. There's a product AMSAA Fog. This AMSAA Fog, what it can do basically, it binds the glycoprotein, binds the envelope proteins to strongest hydrogen bonding with its API. So AMSAA Fog is basically very useful, very safe, tested from animal trials. A lot of animal trials have done, the efficacy trial. It is basically, the antiviral, antibacterial, antifungal. So here I mean to say that in India, the novel drug first time ever developed, and developed by me, in fact. So I should tell that in front of camera that this is being DCGI approved and CDSC approved, and all recognized top research institutes have given us the credential for that and tested for products. So AMSAA Fog can be useful in this case, that only tracing, only the finding out the what the context and all. That is not only the point that we should focus on. We should focus on the remedy. That is, there is no vaccine, there is no antiviral medicine. So the specificity of the medicines used by the doctors will not only give the recovery, because 2 cases we have found, one has gone in ventilation. So I feel that if you want to maintain the hygiene and all, not only cleaning hands, also you have to clean the air, clean the beds, clean the cloths, etc. That is the fogging. That is AMSAA Fog, basically, which can be used for fogging whole the air in the surfaces and everything. And I feel that in coming days, with Nipah virus coming, we should battle it. Not only that, only should find out who are the infected and how many infected numbers are coming. Numbers are not important. Important is that the remedy, and that is there is no remedial medicine in vivo. So automatically we have to go for external use. So AMSAA Fog will be working very nicely. Thank you very much. All the best.